So the next is the cytomegalovirus. The cytomegalovirus, it is the member of herpes family and cause various infection in the human. The cytomegalovirus is also known as HHV type 5. So remember, this virus, it can be found in various body fluids like saliva, blood, urine, tears, etc. So remember the cytomegalovirus. This cytomegalovirus, it is a type of herpes virus that contains a double-stranded DNA. And it is known for its distinctive spherical capsid. So the capsid, it is just a protein coat that will surround and protect the genetic material of the virus. Remember, its capsid, it is spheroidal in shape. So this cytomegalovirus, it is transmitted to various routes like including congenital, neonatal, sexual contact, blood transfusion and organ transplantation. So seroprevalence, it varies with the age. About 50% in individual age 6 to 49 years and over 90% in those with the above 80 years. Now how do this virus spreads? The virus can be present in the bodily fluids like saliva, blood, urine, tears, genital secretions and the breast milk. So it can spread through the organ transplant. The people who receive organ transplant are given medications to weaken their immune system so that their body do not reject the new organ. So this make them more susceptible to infections like cytomegalovirus. So if the donated organ will carry the virus, it can spread to the recipient. It can also transmit through the blood transfusion if the donated blood contains the virus. The third, it can transmit through the breast milk of the infected woman. Infected women can pass the virus to their unborn babies. Now the cytomegalovirus, they are often asymptomatic, but symptomatic cases occur with the immunosuppressed adults and those with the AIDS. So remember the biopsy sample that are taken from inside the mouth that shows the cytomegalovirus related lesions. In these samples you may find scattered infected cells that appear very swollen. So these cells, they will have inclusion bodies both inside the cell, that is in the nucleus, and its outer part, that is the cytoplasm. So because of their appearance, these enlarged cells are known as owl eye cells. So special staining methods like Crocot-Gomory and PAS stain can help to highlight these inclusions in the cell cytoplasm. Now, what are the clinical features? The cytomegalovirus infections, they are asymptomatic. Congenital cytomegalovirus, it can lead to jaundice, hepatosplenomegaly, thrombocytopenia, and CNS involvement. In the immunocompromised patient, such as transplant recipients and those like patient with the AIDS, they are high risk for the severe cytomegalovirus disease. So the symptoms, they can include from mild fever to multi-organ involvement, including the hepatitis, leukopenia, pneumonitis, gastroenteritis, etc. There could be chronic ulcerations caused by cytomegalovirus in the immunocompromised patient. These are the chronic ulcerations associated with the patient with the AIDS. Now, how can you diagnose this cytomegalovirus? We can diagnose the cytomegalovirus through the biopsy technique, through viral culture, and PCR. They are other method to detect the cytomegalovirus. In the blood, there may be increase in the atypical lymphocytes. So what are the treatment? The cytomegalovirus usually go after on its own, but the immunosuppressed patient may need treatment. The treatment of choice is canciclovir and antiviral drugs that could be given. Moving to next is the infectious mononucleosis. So infectious mononucleosis, it is caused by Epstein-Barr virus or human herpes virus type 4. So the virus, remember, it is transmitted through intimate contact, like kissing or sharing utensils. So most infections in children are asymptomatic. However, symptomatic children may exhibit fever, lymphadenopathy, pharyngitis, hepatosplenomegaly, and the respiratory problems. Pneumonia is a frequent complication that could be seen. Apart from that, their complications can be splenic rupture, thrombocytopenia, autoimmune hemolytic anemia, aplastic anemia. Now, very important is how will you make diagnosis of infectious mononucleosis. The diagnosis is through, remember for your MCQ exam, the diagnosis is through heterophile antibody test and IgM antibodies that cross-react. The heterophile antibodies, they are just the IgM antibodies that cross-react with the sheep and horse erythrocytes. So they are used for the detection of Epstein-Barr virus. Other test is the monosport assay or the Paul-Bunel test. They are the common methods for detecting heterophile antibodies. So real-time PCR, it can be used for the immunocompromised patient. The Epstein-Barr virus can be associated with various conditions like like nasopharyngeal carcinoma, oral hairy leukoplakia in HIV patient and transmitted patient, Burkitt lymphoma, and nasopharyngeal carcinoma. So that is point important for your entrance exam point of view. The infectious mononucleosis typically resolves within 4 to 6 weeks. The symptomatic relief NSAIDs can be given. They are the anti-inflammatory drugs that helps to alleviate the common symptoms. Adequate fluid intake and nutrition, they are necessary. The patient with significant spleen enlargement should avoid contact sports to prevent the rare risk of spleen rupture. Antibiotic avoidance, ampicillin, amoxicillin and other penicillin should be avoided as they can cause skin rash in patient with the infectious mononucleosis. Corticosteroids. Some clinician may use the short-term corticosteroids. They are used to reduce the acute symptoms. Corticosteroids may be considered for the severe complications like airway obstructions, hemolytic anemia, thrombocytopenia. Antiviral drugs like acyclovir, valcyclovir, famiciclovir, they can be given. Moving to next comes the enterovirus. So they are the part of the picornavirus, Picornaviridae family. The most common is the herpangina. Herpangina, it is caused by various types of Coxsackie virus, A1 to A6, A8, A10. The hand, foot and mouth disease, it is caused by Coxsackie virus A16. And acute lymphonodular pharyngitis, it is associated with A10 Coxsackie virus. So most of cases these infections occur in summer or early fall. The crowded place and poor hygiene, it contributes to their spread. The main way these viruses they are spread is through the fecal-oral route. So regular hand washing is important during outbreaks. The incubation period is usually 4 to 7 days. The symptoms of herpangina include sore throat, difficult swelling and fever. The patient may experience cough, runny nose, loss of appetite, vomiting, diarrhea, muscle aches and headache. So usually a small number of lesions around the soft palate or the tonsillar pillar, they could be seen. The ulcerations are small. It takes time of 7 to 10 days for them to heal. The hand, foot and mouth disease, it is similar to herpangina where skin and rashes and oral sores happen along with the flu-like symptoms. There could be sore throat, difficult swallowing and fever, cough, running nose, loss of appetite, vomiting, diarrhea. These are the associated symptoms. So the skin spots start as red patch, then become blister in the center and they heal without scabbing. The mouth sores are similar to herpangina but they can be more and might appear more in the front of mouth. These sores are usually 2 to 7 mm wide but they can become even bigger, turn into ulcer and heal within about a day. So for diagnosis herpangina, hand, foot, mouth disease, doctors usually look at the symptoms, how they appear. Lab test can be done to be sure. PCR technique are really good at finding the virus in the body. Most of time these infections go away on their own without causing any big problems.